So good morning, everybody. It is wonderful to have you all here. My name is Aurelija Galvelytė. I am a co-founder of 2AM Health. It is a consulting company that supports life science and health tech startups in commercializing their technologies. But beyond working with startups, we also work with institutions and bigger companies as well. And that's why we are proud to contribute to this roundtable discussion that is organized by Lithuanian University of Health Sciences and Novartis, pharmaceutical company. So roundtable discussion on the topic doctor turned entrepreneur will serve as an introduction, as an inspiration for the participants of Hospiton, a hackathon focused on cardiovascular diseases that will kick off in November. And the topic itself, doctor turned entrepreneur, I think it's very, very interesting one. And to dive deeper into this topic, the challenges, the advantages, disadvantages of entrepreneurial journey of medics, we have invited today 4 doctors that join our discussion. So first of all, we have Bogdan Oancea, who has many years of clinical experience, specialized in diabetes management, and currently is a CEO of Insullock, a startup that is working on virtual assistant for insulin therapy. We also have Arnas Karužas, cardiologist, CEO of Ligence, a startup that focuses on automating cardiac ultrasound procedures. We also have Rokas Šerpytis, cardiologist, founder of Cardiyou, and Miltiadis Triantafyllou, cardiologist as well, and part-time CEO of Xsilico AI. So really great, experienced group of participants, and I am sure that our listeners will get loads of useful insights from you. So thank you for being here. And to start our roundtable discussion, first of all, I would like to invite you all to briefly introduce yourself and your startup or idea that you're working on. So we can set the ground together. So let's start from Bogdan. If you can tell us a bit more about you and Insullock, please.
Me a little bit more about Insullock. It's called the Virtual Insulin Therapy Assistant. It's an automated process for the injection of the insulin and also of these novel drugs for losing weight. It's called GLPs, also injecting in the abdominal area. Briefly, because of wrongly injection technique and sites, people develop lipodystrophy. It's not a severe disease, but it leads to severe disease, especially in the diabetes field. Like all the complication could be hypoglycemia, coma, and deaths only because of this wrong injection of the insulin. And that's our idea, to rotate these points, to scan the abdomen, and daily injection recommendation, management, and many other things. Briefly, this is the idea.
Okay, and before the startup, you were a doctor yourself. You were working as a doctor, right?
Yes, I was working also as a doctor. I was teaching in the medical university, in the nutrition field, in the prevention medicine, but maybe I didn't find my spot very well. To anticipate your next questions, maybe.
We will go into the next questions in a moment about why one decides to become entrepreneur, but let's move first to our colleague Rokas, who can also please introduce yourself and your idea or technology or startup briefly.
So morning, my name is Rokas Šerpytis. I'm a cardiologist by training, and have founded the platform for monitoring wearable data and implementing monitoring to help doctors to monitor their patients and how they are succeeding in treating high blood pressure and high cholesterol. And our focus is to implement these novel techniques that more and more people have and help to improve the treatment of these 2 ailments, because they are one of the highest influences on high mortality, especially in Lithuania, of cardiovascular diseases.
Okay, thank you, Rokas. Miltiadis, please, if you can introduce yourself and your startup.
Yes, hello. My name is Miltiadis. I work as a cardiologist in Sweden. I'm internal medicine specialist as well, and I have founded with 6 others Xsilico AI, which is a company specialized in deep AI algorithms and large language models, and try to make very accurate and secure digital summaries and summarizations of patient data from electronic health records in order to guide both the diagnosis and the follow-up. I have tried our algorithms in both synthetic patients and some real patient data, and we see there is a potential.
Wonderful, thank you. And the last one, but not the least, Arnas, please, if you can introduce yourself.
Yes, as you mentioned, I'm a CEO of medtech startup company Ligence, and also I'm a cardiologist. Our goal is to automate and standardize heart ultrasound as much as possible, because we can see a huge variability, a lot of disadvantages of this, one of the most important tests. That's why we decided to implement artificial intelligence into this casual everyday test in order to improve all the process, all the workflow, and we're moving forward.
Thank you. Thank you all for introductions. Lots of interesting work that you are doing. But now let's dive deeper into some specific aspects of your entrepreneurial journeys. So entrepreneurship in general has this image of, activity that, or a lifestyle sometimes, that is very intense, very unstable. It requires a lot of work, sacrifice, hustling. It is hard to, balance it, create good quality of life, and so on. So what was the moment when you thought, okay, I've heard this, but despite all of this that I am hearing, I would like to still try this journey for myself? Could you share what was the moment when you realized I would like to try entrepreneurship? Let's start from Rokas, maybe? Can you share with us?
Sure. So I'm a very techie guy, and I had a lot of ideas before that, but I was finishing my PhD, so I didn't have much time other than the research that I was doing. And in the final half a year of my PhD, I finally decided, okay, the next step is coming, so I have to do it, because in my work, I work full-time as a cardiologist as well. I see that we always struggle with failure. And I've been working in this field for quite a while. And the way I see it, when we talk to patients, that even though they try to treat those diseases, a lot of them cannot do that very well. And for a long time, we didn't have this technology. And then people started using all the wearables, all the things, internet-connected things at home. But it was difficult for one person to analyze all that. And with the advent of AI, it can help to fast forward the data analytics side and help to pickpocket all those difficult patients that we should treat and increase the treatment. And when I realized that, okay, it does not get much better, so I have to change something. And by just watching others doing it, you wouldn't have as much influence on the processes in itself. So that was the moment when I decided, okay, so you have to somehow change it yourself and just use that knowledge that I have and technology, that all the sorts of different devices that I've used in my practice and with my patients, and just to connect them and that I could monitor them all the time.
Very, very interesting. Thank you. Somebody else wants to share? Miltiadis, do you have a moment exact in mind when you thought, okay, I'd like to try entrepreneurship? It's something interesting.
Yes, actually, before this, I was also involved in the administration, and I was lead of the cardiology in my hospital, and I'm currently the lead in heart failure in region Halland, which is a region in Sweden. And when I realized I cannot influence everyone from inside to change the system, then I said we have to go outside as well to change the system. So my failure as a lead in order to try to give to our patients same quality of healthcare triggered me in order to go outside and try to create a system that secures the quality and tries to make our time useful for our patient and not for the administration. So Xsilico AI wants to reduce the administrative work that the doctor has in order to free more time for the patient.
So what I'm hearing here, both of you, the actual driver to start was not, I don't know, financial reward possibility or becoming this, sexy startup CEO or something like this. It was really about efficiency and patient, actually caring about your patient, caring about wasted resources and really patients that are not getting adequate healthcare. What about Arnas? What about for you? What was your driver? Or what was the moment when you decided to start?
Yes, the most impactful moment I can remember. I remember when I realized that I really bored with only writing the publications, and I decided that I really need to make something real, and it's really inspired me and my future team that we really want to create something important in the real practice. Just stop to only publishing. Of course, it's only also included into our process, the scientific part, but we wanted to create something real, something valuable for the patient, for us as a community, and I think this was the main driver.
Great, thank you. Bogdan, you have something to add from your experience?
I will start with the words of a famous cardiologist. It's the first one who made a heart transplant, Christian Barnard, who said that in my whole life, I saved like 267 patients, but if I work in the preventive medicine field, I will save millions. So this is a powerful idea for me, and actually, for me, it didn't start it from the idea. It started from the things that I want to do something to make a difference. Actually, now I have 2 more apps in my mind. I write the data for them. So it's not the idea, but my attitude and my wish to do something to make a difference.
Okay. So it's much more, let's say, noble purpose or noble driver.
But also I enjoy a lot. So it's kind of a lifestyle of work style, which suits me very well. Like I want challenges. I don't like to be bored in a consulting room. I don't know. It's maybe me. I'm different, but we can talk a lot.
It is true that you have to have specific personality. Yes. If you really like predictive style of work, it's hard to be entrepreneur. Yeah.
For a doctor, it's really kind of opposite mentality and skills, let's say. Not completely, but it's a lot of differences.
Okay, all right. Thank you. Thank you all for sharing this. So moving on, before you started, did you actually have any kind of preconceptions how the entrepreneurship looks like, or how would it be? I don't know. For example, maybe to be entrepreneur is not as humble activity. To earn money is not as humble as to save lives, for example, as to treat people. Or another preconception that I hear sometimes is, well, I don't want to become entrepreneur because then I have to always depend on my investors. You know, I will lose freedom. I guess what I'm asking is why we don't have many doctors that want to try to become entrepreneurs, and what are the preconceptions that prevent them from even trying? Are there any, I don't know, societal or maybe mental blocks or maybe beliefs, preconceptions that prevent people from going this way? I don't know if any of you want to reflect on this and have some ideas to share here.
I can tell.
Please.
Yeah, so as it's always difficult to start. Everybody at some point in their life thinks, oh, I could do this, I could do that. Or they say when they go to their art museum, oh, I could have drawn that. But it means, okay, you could, but you haven't. That's why you are not an artist. So a body in motion stays in motion. So for everybody to, the most difficult part is to start moving. And when you start moving, start motioning, then you can pivot. And that's the main preconception, I think, that, and the fear of everybody, so that they would go out of their safe box and that fall off that safe cliff, and they don't know what might happen next. And yeah, and everybody's, especially in Lithuania, I believe in many countries around the world, the doctors are overwhelmed with work, with patients, with clinical duties, with research, with education. And then having one more thing besides the family makes it way more difficult, right? But yeah, so you have to have the drive, you have to have the energy, and you have to have some insaneness in your brain so to wish to change the system, to change the world. And yeah, I always believe that you can, and everything in life is personal connections. And sometimes the system does not work, but you have to push somebody here, to push somebody there, so for the systems to start moving. And that's, I think, one of the main fear, that you're the sole individual, and it might not be enough for you, the soul of you, to make that change. Yeah, so probably that.
Thank you, Rokas. Very, very powerful insight, really. Anybody else that wants to reflect?
Yes, I would like to add, I really totally agree with Rokas. I think one of the ideas that probably physicians are afraid to go to even more harder field than they are currently in medical, because, you know, physicians, we have very deep knowledge, but very narrow knowledge, and the startup business, and especially if you're going to C-level position, you must have very wide range of knowledge. And when I started, I realized that my knowledge is like zero or even in minus level regarding all the other fields like legal, business, marketing, sales, and etc. You know, my knowledge was only based on medical field, and I thought that it's enough because it's medtech, it's about medical technology, and that's it. But no, and especially I realized how dumb I was when I went to the first conversation with investor, and I realized that, you know, I really must improve myself much more.
Okay.
I can fill in just a bit. Like I had two, and I have actually right now two preconceptions or prejudice. Like I've seen efforts from the big tech companies with Dr. Watson and Google, and they failed tragically. And I was almost sure that these companies lack the deep knowledge that we doctors have meeting the patients working in healthcare system. There is quite like doctors are a fascinating species, I should say. We are not scientists. We are not. We are like artists sometimes, and we are lost in our world. And the world with the patients is what I love the most. But we also bear the responsibility to drive the innovation. There are, of course, other sciences, biologists, chemists, and they help very much. But we always come up with some problem, some hint from the real patient, and try to go out and seek for help. Of course, there are innovations like totally outside that affect us. But I think in the healthcare and the AI world, we lack the input from real doctors. All these big tech companies lack the inspiration that we have to bring working with the patients. And what I see is that I'm totally disturbed from all this software that is like 90s software. It hinders me from having a contact with the patient, which is meaningful. And in the same time, for other things in our life, social media and all these other things, we have like incredible software. So I would like to bridge this gap in order to bring the 21st century in the patient-doctor relationship.
Yeah, especially because the potential is huge, and healthcare is one of the least innovative industries so far. So definitely there's a lot of space for innovating also in this sector. Bogdan, do you have anything to add about your preconceptions or your opinion why not many people dare to become entrepreneurs when they are doctors?
My colleagues, they said it very well. Thank you for this insight. I would like to add more the relationship with the money. This is a big mistake for a lot of people. There are great books on this field. Money, they are not dirty, they are not negativity, they are just an energy. It depends on us how we deal with this energy and how we want to let it enter in our life and how we can do with this energy, like the benefit for the other, for our family, for ourselves. Why not? So for me, it's the best part if the money are coming and a lot of it. It's so, and maybe this is a preconception, like you said, for the doctors. I said it before, it's kind of opposite. But if they change the mentality, it's not opposite at all. It's the contrary.
Exactly.
The future of the medicine is digital, is for sure. You can read everywhere this and more like ChatGPT, and this is turning the medicine digital in an incredible speed. So
yes, and I think
this is
what
the
you
future
say
for sure.
about money, it was really, I quoted one of the interviews that we've done. One of the doctors said, okay, it's much more, it's a higher purpose to treat people rather than, occupy myself with meeting investors, fundraising, making money, becoming an entrepreneur. But Bogdan, what you're saying is true also because you need money to make impact, right? And sometimes
Sure.
if you just work with one patient in 1 hour or two patients in 1 hour, the impact is much smaller than if you can fundraise, create a technology, apply it, introduce it to the bigger population. Also in case of prevention, what you are working on, but also if we speak about analysis or treatment options, the impact can be much bigger. So money is maybe just means to arrive to much bigger purpose rather than being something less humble than the purpose of healing people. Good.
And also, let me add every great innovation, every great thing in the world, it has a lot of challenges. So we have to overcome these challenges. It doesn't matter, like money, like If we have the higher purpose to heal the patient, like I said, millions with this application can heal millions, we reach them, we can do it. If these are challenges, we can overrun them.
Yes, wonderful. So I'm happy we touched the question of fundraising and meeting investors, what Arnas shared as well. Okay, you decided to become entrepreneur, you have a great technology, you have great idea, you want to commercialize it, and then all these practicalities come. Fundraising, building a team, getting information about how to protect intellectual property, how to enter the markets, how to do market analysis, and so on. So now I would like to reflect a bit on practicalities and how did you deal with that in your daily life? Because, being a doctor, being a physician, you probably never had to think about, I don't know, for example, how do I find the right talent for my team? How do I employ the right people to work with? Or how do I find investors or grants for my technology to develop it further? So could you share a bit about all the hurdles that you experienced in developing your startup, and how did you deal with that? So maybe we can just break it down to, for example, finding financing, so funding, investors, grants, and second question, choosing the right team to work with. How did you deal with these two very, very important, I would say, the core issues in running any startup or any business?
I could start if you want.
Please.
Well, actually, we were working in a project inside the public hospital of Region Halland, and then there I met the team, young people, data scientists. So in the company we are me, a doctor, and 6 data scientists. Out of them, I think everyone has a PhD except me, and 2 of them are professors in AI in Amsterdam University. So it's like I always wanted to be with smarter people than me, even as a child, and I found this opportunity and I took it. So I found the team before I found the company, but then I was trying to see how to find money. And the only thing I could imagine was to make a partnership with these people and share everything in the company. So we had equal shares. Everything is transparent. I'm the CEO, but it's like we sit among equals. Because I think it's better to have 14% of something than 100% of nothing. So, and then the start, they all bring this partnership brings them in action because everyone is working some other job. I actually went down to my clinical job in order to have time for this. But I see now that this equality brings all the other parts to activate and to bring the contacts and to bring the time, and it's a volunteer job. But of course, there are limits. Okay, so when and now I think we are in these limits where you have to find money in order to finance some other people that will work with the product and the project. And there, I think, as a small startup, it is easier to try to talk with a venture capitalist than with the finance from EU and from the national research, let's say the public funding. They are more oriented in the university and very big organizations that have the bureaucracy in order to apply. Whereas the venture capitalists, it seems to me, of course, there is a lot of work. I haven't talked with one yet, but I prepare the pitch deck now. It seems more easy. Like if they believe in you, they maybe invest. But the other big public funding or the EU funding needs a lot of bureaucracy. It's almost not possible for us to do it.
Mm-hmm. Arnas, do you have anything to add to this? Because I think you've been through a lot of these fundraising activities so far.
Yes, I really feel this topic.
Is it like this?
Miltiadis, and I'm thinking, oh my God, yes, I remember everything, and I'm dealing with it now. Yes, I think looking from the team perspective, it is the core thing to collect the team, and especially when we're looking from the doctor's perspective, and when you're starting something, you need to collect a team and team members with the very various competences, and the core competences you need to start. This is a very important thing, and very often you realize that in the very beginning of the company, all the team will be working for free because you don't have any funding. So the idea has to be so strong that drive all the team to move forward, and even dedicate the full time to drive the idea and to make it to get the first funding. And regarding the funding, I think Lithuania, we have now quite good funding situation. Why I'm saying that, because we have separated funding opportunities for different stage startup companies, because maybe 5 years ago, the hardest part was to fundraise for the very early stage startup companies, because there was a gap in this part, even from public granting, also from VCs, because VCs, they are much more interested in revenues generating companies, and always like asking how much revenues you're getting, how much revenues. Oh my God, I only started my idea, I'm doing some R&D stuff, and you're asking for me about the revenues, you know. And still, for me, the direction is quite similar 1 or 2 years ago, because you always need to focus on these VCs which are seeking to invest in really deep technology companies, not Apple or prune making companies. When you second day, when you start at a company, you can start to get revenues. This is important part. So our funding currently is mixed. We are funded by angel investors, and I want to remind that we have very good possibility in Europe and in Lithuania to get funding from the angel investors, also Coinvest Fund, and we also have funding from EU grants and from the EIC Accelerator program. We get investment as a grant and as investment part from European Innovation Bank.
Very good. Bogdan, would you like to add to some reflections on the team selection or the fundraising, if that was challenging for you, and how did you deal with that?
We applied to Hackathons Accelerator. Luckily, we get a grant from EIT Digital Ventures, and we have like contact with angels and VCs, but you know, in medical field, our application, it's more like a deep tech, and they almost all said that we are for years EIC Accelerator and this one, because it requires a lot of money and they will not invest in these early stages. So we are.
You are trying to explore the possibilities.
Yeah. Yes.
So
first,
I could add maybe.
Please, Rokas.
Yeah. So the idea of making this platform came like half a year ago, and right now we're in the process of making an MVP. And the way it goes, that when you have some idea and you like participate in some accelerator, then get the like-minded people who have also some work done in this field, and then they can join. You can join forces, and it's like when I started building my house, I bought a old fixer-upper, and I didn't have any experience in that, and I bought it and said, okay, so now what? and I don't have one telephone number. Then I asked some friends, like, whom could I start with? Then they gave me the telephone number of a lady. Then I talked to her. Then she said, okay, go there. And then it all started. And now I live in a very nice house that I built myself, and gave me a lot of experience of life learning experience that nowhere else you could get. And this the same thing with this startup. You have the idea, you have the means of your experience, and then all the parties participating in that join you, and then you assemble the most optimal team for your project to go forward. So probably I think that's the way to go. But when talking to angel investors and venture capitalists, they are always they say, okay, show me the product and show me the money, show me the revenue, and then we'll talk about the money that we can invest. So, and it's always good to have something to show them. Then you would not have to give away a lot of the equity that they give you money for. Yeah, so then it's better to participate maybe in some, I don't know, like in Lithuania, we have wonderful opportunities with the Ministry of Innovation that they give you money for like this level 1 and 2 products. And then when you have this product, when maybe you have some revenue coming in, then it's you have a way higher odds of talking to this venture capitalist and then getting more value out of these investments that they give you, because they're always saying, okay, so show me the potential, show me what's the money time frame, and then how viable is this idea, and they decide a lot of the time by that.
Yeah, so really show me what I'm getting in return for the money that I'm giving you. Exactly. So what I'm hearing is that really in hiring and choosing a team and also fundraising is a process, and you learn kind of by doing it. And sometimes you are luckier, sometimes you are less lucky, but there is no perfect recipe to know upfront. You just have to go for it and do it, right? We are running out of time, and I ask just for the last question, but maybe this is the most important question. I don't know. I hope that it will inspire our listeners and our participants of the hackathon. But what I would like to ask all of you, what would you like to say to the doctors, physicians, that are seeing the limitations of current health tech solutions, of current health public systems, that want to help their patients, that want to make a change, but simply don't dare to develop a technology or solution by themselves, or a startup by themselves? What would you like to say? If we can have 1 sentence or 2 sentences from each of you. And it can be encouraging, it can be realistic, it can be confronting, whatever you feel like you would like to say as a final message of this roundtable.
I think if I can start very shortly, I think the key thing is to be brave and not to be afraid to start something, as Rokas mentioned in the beginning. It is the crucial and the most important part. And I would like to remind the very important thing regarding starting some company, startup, or just an idea. You never lose if you will start to create something, but you can really win a lot if you will be successful with it. So I think you need to remember always this phrase, and you can be then much more braver.
Thank you, Arnas. Wonderful.
So I can go further,
please.
maybe. Yeah. So yeah, probably my message would be that if you see a gap in the healthcare system and you believe you have a solution, don't hesitate and just do it. Because in 20 years, you are gonna be regretting not the things that you did, but the things that you haven't done, which is my motto in life. And well, if I think about it, just do it, and then go and look from the next step what to do next. That's it.
Thank you.
I could say that that's what I did at least, try to find the startup that you would like to work for, approach them as a doctor, tell them what you have. Most of the times they will steal your idea, which is like happens. But if you find a startup, you can work and you will learn a lot. If you don't like it, then start your own. I think this is a very good way in order to see if you like this field. Because in the way, maybe you say, I don't like this field, and I will go back to my patients, which is like a very good thing also.
Totally, totally. And Bogdan, what would you like to share and advise?
Go for it. Go and make a change in the health system, healthcare around the world, and in the health of the patients. Go for it.
Thank you. Well, thank you all very much for reflections and opinions and for sharing your experience in such an honest way. I am sure that this information will be very useful for the participants of the hackathon. There will be some doctors among them, so hopefully your stories will be inspiring to choose this entrepreneurship path. Because I'm thinking that at the end of the day, it is always a choice to remain part of the problem, to keep this, we have done it always this way attitude, or to try to become part of solution, even if it means that you have to create the solution by yourself, as you all are trying to do. So really, thank you all for sharing, and I wish you all the best, good luck, and good luck to our participants of the hackathon. And I hope you will come up with some groundbreaking ideas. Thank you, and goodbye.
Thank you, good luck.